Someone lied to you. You have been told that weak legs and wobbling balance are simply the price of getting older. That is not the full story. There is a quieter, fixable reason many people over 60 start to lose strength and stability, and it all happens while your body rests. In days, you can begin to feel steadier and recover faster if you apply 3 targeted vitamins before bed with a simple routine. A hidden combination of deficiencies and nightly habits is the real culprit, and I will show you which nutrients to prioritize and exactly how to take them before bed for best absorption. Research, including a 2020 randomized trial and a 2019 meta-analysis, suggests that correcting these deficiencies reduces risk of falls by significant percentages and improves muscle recovery in weeks. Today, I will list the 3 bedtime vitamins that matter most for leg strength after 60, how they work, safe dose ranges, and a practical nightly protocol you can start tonight. Before we dive in, tell me in the comments where you live, your age, and which supplements you already take, and we will answer with a practical suggestion. Stay until the end to learn the exact form that works best and what to avoid. Now, let us begin with the third item on the list, the vitamin that most people overlook. The third vitamin is vitamin B12, specifically methylcobalamin, usually as a sublingual form, which targets nerve repair and energy in the muscles. B12 deficiency is common and silent in older adults, and a 2018 study showed that low B12 levels are associated with slower gait and higher fall risk. Mechanism is straightforward. B12 supports myelin repair and mitochondrial energy in muscle cells, so when you correct it, your nerves transmit signals more reliably and muscles respond with more coordination. Symptoms often start as subtle numbness or a tired feeling in your feet, then progress to stumbling or cramps. The best forms are methylcobalamin sublingual or injections for severe deficiency. Typical safe starting ranges are 1,000 to 2,000 micrograms sublingual daily or as advised by your clinician, and many people notice improved balance and reduced pins and needles within 2 to 4 weeks when combined with other nutrients. Case example: George, a 72-year-old retired teacher, began a sublingual B12 at night after dinner and reported warmer soles and steadier steps in 3 weeks. He described the first night noticing the cool tile under his feet felt smoother and less prickly, which he called a small victory. For absorption, take B12 before bed after brushing teeth and allow it to dissolve under your tongue. This avoids stomach acidity loss and works well if you also avoid heavy alcohol within a few hours. Now, moving to the second vitamin, the one that repairs muscle while you sleep. Vitamin D3, known as cholecalciferol, is the second item, and it plays a central role in muscle strength and receptor-mediated repair. A large meta-analysis in 2019 found that vitamin D supplementation reduced fall risk in older adults by about 30% when baseline levels were low. D3 increases muscle fiber function and interferes with microinflammation that slows recovery. The reason to take it before bed for some people is that pairing D3 with a small fatty snack in the evening improves absorption, since D3 is fat-soluble and the overnight window is when muscles perform most of their repair and protein synthesis. Typical dosing ranges vary from 1,000 to 4,000 IU daily depending on baseline levels, and your doctor may recommend higher loading doses initially. Tips to maximize absorption include taking D3 with a teaspoon of olive oil or a bite of avocado before bed and checking serum 25OH vitamin D after 8 to 12 weeks. Forms that combine D3 with magnesium often help because magnesium is a cofactor in muscle relaxation and recovery. Example patient interaction shows how timing matters and how a small evening snack changed outcomes. The first item, the one most people do not expect, is vitamin K2 in the MK7 form, which acts like the traffic director for calcium and supports bone-muscle interaction and vascular health. Think of K2 as the conductor that tells calcium to go to bone and not to soft tissues, so muscles and tendons work with proper calcium distribution. A randomized study in 2017 showed improved vascular markers and bone-related proteins with MK7 supplementation, and observational data links K2 with reduced fall-related fractures. K2 works synergistically with vitamin D3, so taking D3 and K2 together before bed enhances the way calcium is used during overnight repair. Recommended MK7 dosing is typically 100 to 200 micrograms daily. When combined with D3, the duo supports muscle function and helps prevent misdirected calcium that can stiffen tissues. Anecdote: Maria, a 68-year-old volunteer, noticed less calf tightness 3 weeks after adding MK7 with her evening D3 and B12 routine. She described the sensation as her calves loosening like a knot untying, which made walking down the garden path feel easier. K2 is especially helpful if you take calcium supplements or have a family history of brittle bones, but always consult your physician because of possible interactions with blood-thinning medications. Before I continue, I want to pause and ask you to comment your city, age, and current supplements. We read every comment, and our team, including Dr. Smith, Nurse Anna, and physical therapist Lena, will reply with guidance tailored to your situation. We are building a community, and hearing from you helps us answer practical questions and recommend safe doses. While you write, remember this protocol uses B12 methylcobalamin, sublingual, D3, cholecalciferol, and K2 MK7 taken before bed together or spaced as advised by your clinician. If you are on anticoagulant medication, consult Dr. Smith or your prescribing physician before starting K2. Now let me show you how to put this into a simple nightly routine. Implementation is simple and repeatable. Step 1. Take a B12 methylcobalamin sublingual tablet, 1,000 to 2,000 micrograms, allow it to dissolve under your tongue before bed. Step 2. Take D3 cholecalciferol with a small fat-containing snack, for example, 1 teaspoon of olive oil, a slice of cheese, or a bite of avocado, aiming for 1,000 to 4,000 IU depending on your baseline. Step 3. Add K2 MK7, 100 to 200 micrograms with the D3 before bed. Store supplements in a cool, dry place away from sunlight and set a consistent reminder on your phone for the same time each night to build the habit. If you prefer separate timing, take B12 right before teeth brushing, then D3 and K2 after a light evening snack, 20 to 30 minutes before bed. Keep a log for 2 to 4 weeks noting balance, energy, calf tightness, and any cramps. If you notice unusual bleeding, bruising, or new symptoms, stop and consult your clinician. This protocol is designed to work while you sleep because repair processes peak overnight, so taking these vitamins before bed increases the chance that muscles and nerves get nutrients when they need the most. To maximize benefits, adopt 3 support habits that enhance absorption and recovery. Habit 1. Hydrate earlier in the evening, not right before bed. Sip water through the late afternoon and early evening to maintain circulation and reduce nocturnal cramping. Habit 2. Eat a light protein and fat-containing dinner 2 to 3 hours before bed. This stabilizes blood sugar, supports repair, and improves absorption of fat-soluble vitamins. Habit 3. Do 5 minutes of gentle movement 10 to 20 minutes before bed, such as ankle circles, seated leg lifts, and a short walk in place. This increases blood flow to the legs and primes muscles for overnight repair. These habits have physiologic logic. Hydration improves circulation, which carries nutrients. Micro-movements boosts lymphatic flow, and a light evening protein snack supplies amino acids for muscle synthesis. A small 2016 randomized study found that light evening activity plus protein improved overnight muscle recovery in older adults. Build a 5-minute pre-sleep ritual combining hydration, light movement, and your supplements before bed, and you will see compounded benefits within weeks. Now I will share 2 moments of tension many viewers will relate to. First moment, the night George tripped on the patio step. His heart raced, the sky smelled of rain, and the tile felt jagged under his shoe. He froze and for a second time seemed to narrow. He remembered his mother falling and the long hospital smell of antiseptic and lemon. He wondered if this was the end of easy walks to the corner bakery, and whether he would be a burden to Maria, his daughter. Then he chose to call for help, to practice balance exercises, and to try the supplement protocol. That decision shifted everything, and within weeks, the fear of the patio step became an image of a past obstacle, not an inevitable future. Second moment, Maria sat with a folded letter from the clinic saying her bone density was lower than expected. She tasted the metal of worry and felt the cold edge of the paper. The house hummed with the refrigerator, and Tom the neighbor knocked softly. Maria debated starting another pill. The cost and the doubt crowded her mind. But she pictured the path to her garden and chose to add K2 with D3 before bed after talking to Dr. Smith. Those are the turning points where action meets fear, and where a small nightly habit becomes a statement of hope. The internal scenes of doubt have sound, smell, touch, sight, and taste, and they matter because the decision to act is as sensory as it is rational. Throughout this script, we named people who reacted and helped George and Maria, including Dr. Smith, Nurse Anna, physical therapist Lena, neighbor Tom, and friend Harold, who all played roles in encouragement and monitoring. Their voices appear often in consultations and in the expanded dialogues we had earlier and later where George asked specific questions and the team answered patiently. Example dialogue between George and Dr. Smith expanded for clarity. George: I feel my left leg drag sometimes. Can supplements help? Dr. Smith: start with a B12 test and consider methylcobalamin sublingual before bed. George: how much D3 should I take? Dr. Smith: usually 1 to 4,000 IU, but check your level. George: any interactions with my blood thinner? Dr. Smith: K2 can affect warfarin. Talk to your prescribing doctor. George: how soon will I notice a change? Dr. Smith: many people report changes in 2 to 4 weeks, especially with consistent timing before bed. This exchange and similar ones appear in clinic visits, and they model the questions you should ask. In summary, 3 practical steps: B12, methylcobalamin sublingual, D3, cholecalciferol, and K2 MK7 taken before bed as part of a consistent nightly ritual, plus hydration, light movement, and a small evening protein and fat snack can rebuild nerve signals, reduce cramps, and improve muscle recovery, reducing your risk of falls. Start tonight by putting a B12 under your tongue before bed. Take D3 and K2 with a small bite before bed, and set a phone reminder. If you take anticoagulants, consult Dr. Smith or your prescribing clinician first. Tell us in the comments your city, age, and current supplements so we can reply with tailored advice. If this gave you hope, subscribe for more practical evidence-based routines and share this with a friend or family member who needs steadier legs. Let your body do the work while you sleep.